It's time now for our weekend health update, and we've got plenty to talk about. Joining me now is ABC News medical contributor and pediatrician at Stanford Children's Health, Dr. Alok Patel. Dr. Patel, it's always a pleasure to have you on with me. Thanks for coming on.
Happy Saturday, Ike.
Oh, yeah,
Good to
happy
see you.
Saturday. Now, regulators in the UK, they're warning that weight loss medications may cause birth control to be less effective. So what do we know so far about this?
I previously there were these anecdotal reports of people talking about changes in fertility once taking these oral weight loss medications. And initially this people thought this was related to weight loss itself and how that may affect fertility. But this new warning is more talking about gut absorption and how that may change the effectiveness of oral contraceptives, potentially any medication. So the important thing for people to understand is that if you're planning on taking oral birth control and you're on these weight loss medications, to talk to your doctor about potentially another option and using barrier contraception as well. And an important reminder for everyone out there, if you're taking these meds, to talk to doctors about potential interactions with other drugs as well. And that pregnant women should not take these medications because of unknown effects this may have on growing a fetus and some concerns from animal models. So conversations with doctors, very important.
All right, now I want to turn to another major medical story, measles. The CDC, they're reporting that there are over 4 times as many measles cases this year than during the entirety of last year. So are there ways to tell if exposure is present when we're out in public?
They're not, you can't always tell because people with measles can be contagious before we see that telltale rash, even slightly after, which is why it's so incredibly important for everyone to understand how contagious this virus is and how preventable it is. Because right now we're approaching 1,200 cases. We're almost approaching the number for the entirety of 2019, and 95% of cases are in those who are unvaccinated or under-vaccinated. If we continue on this trajectory and we get continuous endemic spread for 12 months, the United States will lose our elimination status, which is a grave, grave growing problem when it comes to public health, especially knowing that with proper education, access, and people getting vaccinated, we can prevent this entire thing and prevent many more illnesses, hospitalizations, and potentially deaths.
Get your vaccines, guys. And
Please.
finally, yes, get them. Finally, a new study finds that marijuana, even in the edible form, raises the risk of premature heart disease. So what else should people know?
I'm glad that you added the fact that even in the edible form, because this is a research study that came out of San Francisco looking at about 55 people and found that those who used cannabis related products chronically, at least 3 times a week, had a higher risk of premature heart disease and lower vascular function. So, in other words, their heart and their vessels were less efficient at pumping blood around, and the risk was increased in those who used edible THC products. Previously, people out there think, hey, if I don't smoke it, there's less of a health risk, but we're learning more and more about all the potential risks when it comes to heart health and marijuana. The American Heart Association has put out warnings. We've seen studies in the past about the risk of potentially stroke and other heart disease for people who chronically smoke this as well. So there needs to be a balance as more people are seeing access to marijuana and all the products out there, not only including smoking it, but when it comes to tinctures and candies and oils and all those cannabis related products that seem to be everywhere.
Whew, gotta slow down on that stuff. Dr. Patel, thank you as
Pay
always.
attention. Just pay attention.
Pay attention. There we go.